In this morning's Health Watch, do-it-yourself medical tests. A growing number of people are skipping the time and expense of a doctor's visit and ordering tests online, which screen for everything from vitamin levels to STDs. Medical correspondent Dr. Jennifer Ashton is here to tell us if this is such a great idea. Doc, good morning.
Good morning, Chris.
So what's the big advantage to doing this at home?
Well, for certain types of tests, the real advantage is it could save you money and it can save you time. Anyone who's been to a doctor's office recently knows if they need to go for a quick follow-up test, that could take hours and it can cost a lot of money. So both of those things potentially would be advantageous, these do-it-at-home tests.
Doctors, such as yourself, when you hear something like this, you think it's a good idea?
For some things, yes. So for simple things or chronic conditions that require frequent monitoring, like your blood pressure, cholesterol in some levels, diabetes, even an occasional urinary tract or bladder infection, obviously pregnancy tests, yes, they can be fine. But we need to remember, it doesn't come with a medical degree, so that's where it gets a little trickier.
Ordering your own medical tests online, now that's something that's becoming a little in vogue these days as well. There's got to be downsides to that.
Absolutely. So first of all, you want to know what type of test you're ordering, and is it going to an accredited lab? Because anytime we as doctors order a test, the lab that processes that test is really of utmost importance. Is it accurate? Also, online, there are a lot of scams, like with anything. So if they try to tell you that they're going to sell you something to treat what they're testing, that's kind of a red flag there.
None of us like to go to a doctor's office and have to sit for 45 minutes an hour. I guess the big question, I know this is convenient, but is it safe?
Well, that depends. Again, you know, when you talk about these things, you really have to ask yourself, what will you do with the result? That's something that even doctors have a hard time with. Don't order a test unless you know what you're going to do with the result. As a patient sitting at home, you might get something that you don't understand what it means. It might generate a tremendous amount of anxiety. In some cases, it might generate unnecessary tests. And if you pick up the phone and call your doctor and say, I just got X result, now what do I do with it? Guess what the doctor is going to say? Come into my office. I'm going to have to repeat that test because I may not trust the lab. And again, you're setting off a whole cascade of events.
And is this a trend that's picking up? Are more and more people doing this because of the cost and the convenience?
Well, I think it is, like so many things. And again, you're going to see more genetic tests offered online where you can check your entire genetic code for certain diseases. Again, how we use that in clinical medicine really is a question mark today.
All right, let's talk about some tips if you are considering actually doing this stuff at home.
Right. So again, first you want to ask yourself, is this going to save you the time and the expense of actually going to the doctor? How many doctors will then subsequently say, I need to repeat that test once you bring them the result? Is it FDA approved? So many of these tests may be available to be done, but they're not FDA approved like so many things. That should be a red flag. Is the lab to which they're sending the result accredited? So some legitimate organization like the College of American Pathologists, for example, you want to make sure that where they're sending your blood, urine, or stool specimen is going to process that sample accurately. And does your doctor approve? Because again, Chris, when you get that result, if you call your doctor and say, Dr. Smith, I just got this result, what do I do now? The first thing the doctor is going to say is, why did you do that test? So make sure you check with your doctor, and he or she will say, sure, absolutely, you can follow that at home, or guess what? Don't do that test at home. Not such a good idea.
And for some of these tests that you do pick up in stores, FDA approval will be on the box, so you just have to kind of look around.
It should be, and again, your doctor should be able to tell you, do it, don't do it.
All right, Dr. Jennifer Ashton, thanks so much.
You
Good
bet.
to see you this morning.